listening to Dr. Mike Dadson, PhD, Counseling Psychology. Visit drmikeDadson.com if you'd like to ask a question of your own.
Well, I guess what I would like to say to a person who has made the decision that it's time for them to seek help or that they're seeking out a therapist, then I'd want them to know that often it's a difficult decision to make, because I understand that when a person makes a decision to open up their lives to a stranger, they don't always know what they're going to get. So what I would hope that people would experience with me, and what I strive for and what I work for, is to help people know that I'm going to accept them where they are and listen to where they want to be and do everything that I can to try to help them to achieve those goals in a way that is comfortable, that's relaxed, and where they feel like they can sit back and maybe even at some point even enjoy the process of learning and growing. So it takes courage to ask for help, and sometimes that can be a real anxious thing, and often that's a pretty normal thing for a person to feel anxious going into a session. But I'm aware of that. I've been doing it for quite a long time, and I'm pretty good at helping people to be able to step back and to work towards achieving their goals. You know, when you decide to see a therapist, that you're making a decision to see someone who has a responsibility to maintain your confidentiality, to make sure that you understand that it's not just private, but that there are legal requirements on a therapist to protect your privacy, and that you're not just looking for someone to give you advice, that you're looking for someone who's responsible to empower you, to follow you, and to accept the decisions that you make, but just to help facilitate that process, to empower you to make the decisions that you need to make, not for someone to impose on you the decisions that they think is right for you. People decide to see a therapist for a variety of different reasons. And sometimes it's a doctor's referral, that looks at depression or anxiety, and then people are coming in looking for some relief from depression, which can characterized by overwhelming sense of hopelessness or despair or sadness. And an anxiety can be characterized by a feeling inside of overwhelmed, or like people often call anxiety stress. There's a bit of a difference between the two, but it can feel like stress or weight, too much energy or sleeplessness or constantly worrying or compulsive thoughts. But to try to find relief from something like anxiety or depression, which I have had specialized training in working with both. And also people can look for times when they're going through a grief or a loss, or a significant transition. So the loss of a child, or the loss of a relationship, or sometimes those transitional times when parents are no longer capable of taking care of themselves, and people are squeezed out between trying to manage kids, trying to make their marriage work, trying to keep their careers on track, and at the same time having to take care of aging parents. So whether it could be career issues or just life transitions, range of different possibilities, PTSD, all of them though, people come and they're looking for someone who has some experience, some sort of knowledge, or some way to be able to help them sort out those issues for themselves. And those are some really good reasons to start looking for help.